Good morning. Study to analyze. Study to analyze the decrease in absolute platelet count as a marker for severe ROP in the premature babies. ROP is one of the leading cause of the preventable childhood blindness in India. The incidence of ROP increases with the decreasing birth weight, gestational age, however, not in all preterm babies, so there might be the other fetal or the maternal risk factor influencing the ROP development. These factors may protect or increase the probability of development of ROP. Recently, platelet has been reported to play the important role in angiogenic regulatory protein delivery. Aim of the study was to determine the association of decrease in absolute platelet count with the ROP among the premature babies and to analyze whether the decrease in absolute platelet count is a marker for severe ROP in those babies requiring platelet transfusion. This study was a prospective observational study done in the study period of January 2023 to July 2023, conducted in 90 babies. Inclusion criteria were babies born less than 30 weeks, less than 1500 gram birth weight with thrombocytopenia after 72 hours of the life. Exclusion criteria was early onset thrombocytopenia before 72 hours of life, neonate who did not survive, and parents who were not consenting for their study. Parameters recorded were infants' platelet count, birth weight, gestational age at the birth, and multiple BT. Revised IC-ROP classification were used for the categorization of the ROP. Babies with decrease in the serum platelet count were divided into two groups, those requiring the platelet transfusion and those that doesn't need the platelet transfusion. In our study, mild ROP was defined as ROP that does not meet the criteria for treatment based on the cryo-ROP study and ET-ROP study guidelines. And severe ROP were defined as either type 1 based on ET-ROP study finding, threshold AP-ROP, stage 4 and 5 ROP that needs treatment. The result shows that among 90 babies analyzed, 40 were males and 50 were females, and there was no significant association between the sex within both the groups. Table 2 showed the gestational age, in which there was no significant difference in the gestational age. Group 1 was 29 weeks to 33 weeks, and in the group 2 it was 30 to 34 weeks. The mean birth weight was almost 1000 gram to 1400 gram in group 1, and group 2 was almost 1000 gram to 1600 gram, and there was no significant difference. The mean absolute platelet count in group 1 was 34,000 to 62,000, where in group 2 it was 44,000 to 90,000 approximate, and there was a significant difference between both the groups. This table shows that there were 33 were severe ROP, 27 were mild, and 30 no ROP was seen. There was a significant association between the retinal findings in both the groups. Among the 40 male babies, 15 were severe ROP, 13 babies had mild ROP, and 12 had no ROP. There was no significant difference between both the sexes and retinal findings. This table showed that there was no significant difference between the gestational age and the retinal finding, and there was no significant difference was found in the birth weight and the retinal finding. But there was a significant difference between the absolute platelet count and the retinal findings. Severe ROP constitute approximate 36.6%, while the mild ROP was 30% and no ROP was 33.4%. There was the mean absolute platelet count for severe ROP in group 1 and 2 were almost 29,000 to 58,000, wherein group 2 was 40,000 to 70,000, and there was a significant difference shown between both the groups, and this was found to be statistically significant. Discussion, they showed that the result of the study showed that decrease in serum absolute platelet count can be used as a marker for severe ROP among the premature babies requiring platelet transfusion. This helped in the production of ROP much earlier in infants with severe thrombocytopenia who are at the risk of developing severe ROP. Recently, platelet has been reported to play the important role in angiogenic regulatory protein delivery. Premature babies developing ROP in the low serum platelet count lack the function of either delivering the optimal level or incompletely scavenges the excess of vascular endothelial growth factor A. Conclusion showed that the thrombocytopenia can be taken as an important parameter for the early production of the severe ROP in infants. This emphasizes the ophthalmologist and neonatologist to provide more attention and special care to those babies with low serum platelet count requiring platelet transfusion, thus minimizing the incidence of severe ROP, and that help in the early intervention and prevention of sight-threatening complications. These are my references. Thank you.